This COVID pandemic over the past year has brought millions of deaths and massive economic disruption across the globe. Today's a big day for Australia in the effort to overcome this scourge, with the nationwide rollout of the vaccines underway. It's hoped all Australians who want the vaccine will have had it by October, but the challenges beyond then will no doubt continue in some forms. Reporter Alexia Atwood joins us now from Sydney. Alexia, g'day. So which frontline worker went first this morning in New South Wales?
Morning, Joe. Well, a cleaner in our quarantine system by the name of Gaia was the first person in New South Wales to get the Pfizer vaccine this morning here at the Royal Prince Alfred Hospital on the edge of the Sydney CBD. And the Premier Gladys Berejiklian and the Health Minister Brad Hazzard were all watching on. It's been an incredible morning of extreme anticipation and extreme excitement that this is actually finally happening. By the end of the day today in New South Wales, about 1,200 frontline workers will have been vaccinated. That's across the three hubs in New South Wales, RPA, Westmead and Liverpool. And then that is going to scale up towards the end of the week once things are running smoothly. And within 3 weeks, around 35,000 frontline workers in New South Wales alone will be vaccinated with their first dose of the Pfizer vaccine, more across the rest of the country. And then in New South Wales, once these frontline workers do get their vaccine, exactly 21 days later, they'll be back with another appointment for the second dose of the Pfizer vaccine. It's been about 13 months since the first cases of COVID-19 were detected in New South Wales, and our frontline workers have been fighting this virus on the front line through some of the absolute darkest days. So it is very appropriate that they are here getting this extra layer of protection against this deadly virus.
It was good. So I didn't feel any pain at all. It was really good. They have a great system in place. I'm so proud of my team over here that they've actually put this together, and it's very comfortable for anyone to come in here and get their vaccination. So the registration process, the vaccination itself and the recovery, it was all smooth and really good.
And Alexia, what does the vaccine rollout mean for life returning to normal?
Well, Joe, there is that hope that by October, a critical mass of the New South Wales population, which is about 8 million, hopefully the majority of those people will be vaccinated and life can slowly begin to really return back to normal. And finally, we will mean that in the truest sense of the word now that we have this vaccine in our armoury. Most Australians will be offered the AstraZeneca vaccine, and it has been revealed this morning that Gladys Berejiklian, the New South Wales Premier, will also be one of the first in line to get this vaccine. As just like with the Prime Minister Scott Morrison getting the Pfizer vaccine yesterday, the Premier Gladys Berejiklian wants to lead by example to show that the AstraZeneca vaccine is just as good as the Pfizer vaccine. And she has said that New South Wales will be operating with an eye on the future to get the economy back on track. But she also acknowledges that we are in a global community and it's going to be a year of learning. We still don't know how this vaccine, how it's going to help with preventing the transmission of the virus. So there is still a lot to learn, but there is hope that when the majority of people are vaccinated in New South Wales, life can somewhat return to normal.
By the end of October, I hope that everybody who's offered the vaccine in New South Wales, which should be the whole population, has had it by that time. And yes, it does mean we can think about the settings. It does mean we can start thinking about overseas travel. We can start thinking about easing of restrictions. These are all things we can start thinking about if a critical mass of our population takes up the vaccine.
Okay, so that was Gladys Berejiklian speaking there this morning. Let's head to Queensland now. Queensland's COVID-19 vaccine is being rolled out on the Gold Coast today. 1,000 Queenslanders are expected to be vaccinated this week and about 125,000 within the next 4 to 6 weeks. Here's reporter Michael Rennie.
Well, it's a huge day here on the Gold Coast, particularly here at the Gold Coast. University Hospital, where around 100 frontline workers will receive the first COVID-19 vaccines that will be administered here in Queensland. The vaccine arrived here on the Gold Coast yesterday and was transported from the airport here to the Gold Coast University Hospital, where it's being stored in a specially designed freezer. It will start to be administered today and all throughout this week. It's hoped that around 1,000 people will receive the jab by the end of this week. There's going to be hubs established here on the Gold Coast, 2 in Brisbane, then hubs also on the Sunshine Coast, up in Townsville and also in Cairns. The ambitious target is 125,000 Queenslanders vaccinated by early April. Sounds like a very ambitious target, but the Chief Health Officer, Jeanette Young, she is confident they can get to that target, and she was actually more relaxed yesterday than we've probably seen her relaxed since the beginning of the pandemic. And she reiterated that she is more than happy to have the vaccine herself in one of the later rollout phases of the vaccine. So not long now till the vaccine starts to get administered here at the Gold Coast University Hospital. We'll find out shortly who the first Queenslander is to receive the vaccine here soon.
Michael Rennie reporting there from Queensland, and we're expecting those Queensland officials to hold a media conference in about 20 minutes' time, and we'll bring you portions of that live here on the ABC News channel. We're expecting to hear from the Victorians at about 10:30 Australian Eastern Daylight Time, so about an hour and a half's time with the Victorians, and we'll be covering the different states and territories through the day here on the ABC News channel. Now, the contrast between Australia and the US with this pandemic is just so stark. The death toll there now close to 500,000. North America correspondent Catherine Diss joins us now from Washington. Catherine, these numbers are just horrific, but is it the case that the deaths and number of cases are now dropping?
Good morning, Joe. Look, they certainly are horrific numbers. More Americans have now died from coronavirus in the past year than the 2 world wars and the Vietnam War combined. This time last year, no one had died from the virus, and we had a president who was saying that it would simply disappear with time. It certainly has turned out to be a very different reality. But as you said, yes, cases and deaths have started to drop dramatically. In the past 2 weeks, new infections are down around 45%, and the number of those who are dying each day is down around 35%. So that's well off the peak that we saw in January, where around an average of 3,100 Americans were dying every day. It's now about 1,800, and the number of cases a day is around 70,000, and that's well off the peak that we reached in January of 300,000 new cases a day. So this grim milestone does come at a somewhat hopeful time for the country, Joe. We heard today from Dr. Anthony Fauci. He is America's top infectious diseases expert. He has been on the front line of this pandemic since the very beginning, but today he took some pause to reflect on what this moment meant. Let's take a listen.
It's terrible, Dana. It's really horrible. It's something that is historic. It's nothing like we've ever been through in the last 102 years since the 1918 influenza pandemic. People decades from now, Dana, are going to be talking about this as a terribly historic milestone, in the history of this country, to have these many people to have died from a respiratory-borne infection.
And Catherine, where are the worst spots in the US now?
Well, like I mentioned, Joe, we are seeing the number of cases falling right across the country, and we have seen a very distinct sort of path that the virus has taken. So this time last year, it was ripping through the northeast of the country, places like New York. That then shifted down into the Sun Belt, so Texas, Arizona, Florida. It then shifted into the Midwest by the fall, and now it's just virtually everywhere. But where the places are that it's worst right now are in the colder sort of states. So New York, Alaska, Vermont, South Dakota and New Jersey are all seeing cases staying around the same. They're not necessarily increasing, but they are definitely the worst hit states at this point in time.
And how's the vaccine rollout going there? Does it look like Joe Biden is going to be able to turn things around?
Look, the vaccine rollout is progressing. It is very hodgepodge. It is a patchwork of different rollout programs from state to state. I read somewhere just the other day that West Virginia is actually nailing it. They're the ones that are leading this, which you just wouldn't expect. But 12% of the country has now received at least one dose of the vaccine, either Moderna or Pfizer. 5% of the population is fully vaccinated. Joe Biden has pledged to deliver or administer 100 million doses within his first 100 days. That is enough to vaccinate 50 million Americans. And at this point in time, he seems to be on track to doing that. We're now seeing healthcare workers administer around 1.8 million shots a day, and that is the pace required to reach that target. And Joe Biden has said that he would like to exceed that target if he possibly can. But the big problem and the big issue that the administration faces right now, Joe, is the spread of the variants. So the UK mutant strain is likely to become the dominant strain here by next month. And whilst the studies show that the Pfizer and Moderna vaccines do work well against that particular strain, the bigger concern is the South African mutant strain, which early studies have shown is actually resistant or it's less effective. The vaccines are less effective on that particular strain. So it's really a race against time here for America to vaccinate enough of the population before those mutant strains do spread out of control.
Okay, Catherine Diss there in Washington. And in Britain, 1 in 3 adults has received a COVID shot. Here's Europe correspondent Nick Dole in London.
Everyone wants to know when the lockdown will lift. It's been a very long and pretty grim winter here with almost no social interaction allowed except for a bit of exercise. But the government keeps using this phrase that it'll be driven by data, not dates. So people are essentially being told to put the calendar away and be patient. Really, the only semi-firm date we have is that the government wants schools to return next month. But there is a lot of pressure on the Prime Minister Boris Johnson to outline a plan out of lockdown. There's about 17 million people who've already had a jab. 1 in 3 adults. Every adult is expected to have the jab by the end of July. And within just the space of a couple of months, all vulnerable people in terms of those who have underlying health conditions and all of the over 50s will be vaccinated. And there are many within the Prime Minister's own party who say that at that point, really, the reins have to be loosened and people have to be allowed to go out and live their lives. There are still a lot of cases here, though, 10,000 a day roughly. Those cases have come down quite drastically in the last few weeks. And the Health Secretary, Matt Hancock, says the early signs of the vaccine working are appearing to show themselves in hospitals too. So if the case numbers are falling and the vaccination numbers are rising, why not lift lockdown earlier? Well, the answer from the government is that it is concerned about these new variants. There are still a few cases of the South African variant still showing themselves here in the UK, and the government says it's not confident that the vaccines it has in its arsenal are as effective against the South African one or the Brazilian one. So for those reasons, the government is warning people not to expect too much too soon when it comes to easing restrictions.